Living well and aging gracefully is what every Singaporean aspires for in their old age. Seeing the elderly working hard to recover motivates healthcare professionals. The immense satisfaction of helping the elderly regain their lives keeps them going every day. By upgrading themselves, healthcare professionals will be able to provide better quality care to the elderly.
When I joined St. Andrew's Community Hospital 5 years ago, I was very impressed by the patient-centered culture and the friendly working environment. And I could see that it was a growing sector. I feel that it could develop my full potential. I think I've been resourceful, and I feel that upgrading of skill is very important to stay productive and relevant. So I sent my team to classes organized by AIC Learning Institute. Being a pharmacist enables me to spend time counseling patients and their family members. And it is human nature to feel good and proud and have a sense of achievement when you're helping someone get better.
In recent years, we are seeing increasing numbers of mid-career switchers joining the community care sector. Ms. Jasmine Tan is one of them.
I was inspired to join community care sector is because of my own experience. In 2001, I was diagnosed with colon cancer, and it was a third stage, and I went through the chemotherapy, which made me reflect what I want in life, and I switched to nursing from engineering. My hospital and AIC was very kind. Throughout this nursing journey, I've been upgrading myself from diploma to advanced dip until the degree course, University of Manchester. As a staff nurse in the ward, I have the opportunity to provide individualized care to the patient in the ward, as well as provide caregiver training to the caregiver and patient education, which help to improve their quality of life. Being also a clinical instructor, I was able to facilitate and to provide guidance to the newly recruited nurses as well as the nursing student. The satisfaction I get from my work is able to see the patient progress, the condition improve, and they are able to go back to their community and age in place. Since 2008 until now, I'm still in nursing and I still enjoy.
Team-based training provides a holistic view of the acquired knowledge, thus benefiting the institutions and the sector. A team from the Salvation Army Peacehaven Nursing Home recently embarked on such a program in Australia, focusing on dementia care.
We wanted to benchmark our services, so we thought Hammond Care would be the right place to visit because we also want to specialize in dementia care and then to run a dementia training center.
I think by going as a team, we not only learn things from within our own discipline itself, but we actually get to learn with and learn from other professionals, and we can discuss about what we think is feasible to be implemented in Peacehaven, and from there actually improve our services holistically for the clients and the family members.
Well, one of the key lessons that I've learned at Hammond Care is their strategy that they use to translate their mission into action.
One of their mission in action steps which they focus on is the use of color and tonal contrast, which they emphasize strongly on features like a person's room doors and toilet doors. Color contrast can also be used for safety features like knobs for hot and cold water taps.
The training has created an awareness for our team to understand the philosophy of care for our organization. They have embedded the model of care and translated the mission into the work in order to have the sense of identity to the staff.
Training at Hammond Care has broadened my perspective, understanding and knowledge of dementia care. Dementia nursing is indeed a specialty, essentially for nurses who are working in ILTC setting.
The need for attracting new talent and continuous upgrading is ever growing. To provide the best possible care for our community, AIC invests in training and enhancing skills through programs such as Balaji Sadasvian Study Award, Social and Health Manpower Development Program, Intermediate Long-Term Care, Medical Social Worker Midterm Scholarship, ILTC-Upgrading Program.
I believe in helping elderly to connect them to other services to provide more holistic treatment for them.
We have a longer time with the patients as compared to an acute hospital, and this extra time allows us as therapists to engage with the patient, fully understand them, and then have a therapy session that is close to their heart.
I'm always working towards clinical nursing, and to be trained as an APN will allow me to be a safer practitioner, seeing to my patient care.
I look up to my seniors who have never failed to help me and guide me, and I cannot be complacent with my current skills and knowledge because the medical field is always advancing. It actually inspires me to further my studies and upgrade myself.
So as an occupational therapist, we can also help with prevention of accidents, and I can take better care of them.
The satisfaction I get from my work is helping patients overcome their difficulties and at the same time working with passionate and caring people.
Upgrading myself in these studies, right, I am able to be more exposed to the more evidence-based practice.
With all this support, the capabilities of the community care professionals and their organizations will continue to grow in tandem with the expanding sector. With better quality care, we can enable Singaporeans to live well and age gracefully.
My motivation is being part of a big team that helps patients get better and go home to be with their family.
It's bringing good cheer to the people I serve.
It's seeing that the patient is able to carry out their normal daily activities better.
Is seeing my residents and family members cope better with their situation.
Seeing the improvements of my patients on a daily basis.
To see my resident enjoy the music session.
To help my patients lead better lives despite their long-term dialysis.
To inspire nursing students to take nursing as a lifelong career.
To see my resident lead a better life.
Is to see my resident enjoy a hearty meal.
Is to see my patient get better.
Seeing my residents enjoy their remaining years.